Clear.
Morning caution light. Check. Engine instruments. In the green. Engine 100%. VADAC auto. Throttle. Fly. Keep us forward. It's coming on.
It comes in spurts. There's some days where we won't fly at all, but other times we'll do 2, 3, and sometimes even 4 a day.
In a way, it's a job. In a way, it's a calling. You're getting there at people's worst times, and sometimes I think it's easy to lose sight of that.
We're one big family. You know, we all want to see each other come back at the end of the day. We want to complete the flight in the best way possible, and we want to make sure that there's a positive outcome.
For residents of Wisconsin and the Upper Peninsula, they are the pilots, nurses, and paramedics of Aspirus MedEvac. Dedicated crews who respond to some of the most challenging cases of critical care when the clock is ticking.
Had a chance in the military to deal with a lot of medics and military doctors, and these guys are on par with that. It's just incredible to watch them work on the patient to get them in the aircraft as fast as we can.
We'd like to be in and out of a scene in less than 10 minutes because time is of a factor. You have that golden hour to get them to a trauma center, or if they're having a heart attack, to get them to the cath lab.
And then after that, you know, they're in the hospital for a couple days, couple hours, couple months. We may not see that end part until we come back. They come back a year later and say, hey, you remember me? You took care of me a year ago, and you know, that's very humbling.
At the end of the day, when we see those outcomes, and we know that we made a big difference in their life, that we made a big difference for the community, I like that feeling. When you see a critical patient that maybe doesn't have a chance and you give them that chance, that's what's important.